I just figured I needed to catch it before, because I used to be really large and I lost a lot of weight. I lost about 100 and, I don't know, 100 and something. And then I was doing really well for 5 years, and then I had a baby. And it's like, it's coming back, and I'm like, no.
Yeah.
I can't go back. I'm nervous. I'll feel better once it's just done. As soon as he said you were done, I was like, okay, I can still leave.
Oh, yeah.
If I go right now, maybe he won't be too mad at me if I leave right now.
Come on, Eric, let's take a look. I see a good jaw. Your teeth are beautiful, well-rooted. You have no obvious gum disease. There are no reasons why I should not do orthodontic jaw wiring for you based on your panoramic x-ray. So were you nervous about this?
Yes.
Yeah, you really were, huh?
Mm-hmm.
All right. You know, that's logical.
But I'm not really nervous now. Now that I saw Ray.
Yeah.
He blazed the trail.
We're going to do yours with the ones that I founded this technique on. We're going to make your two front brackets up in here, your two eye teeth, up the ones that show the most. We're going to put them in clear, and then we're going to wire your teeth through these brackets using the same methods that we used with Ray. And that method was to hold these little straws between your teeth when we do the wire. Okay, you happy and comfortable? Mm-hmm. Can we begin? Mm-hmm. Good. The first part is the preparation of the tooth for catalyst. We'll do the top teeth first. The viewers will notice that this method is substantially faster. This is direct bonding, no light cure. So you position the brackets, the bonding agent hardens up in 20 seconds. The bracket is positioned, the adhesive will harden up by itself. Providers should be aware of the occlusion, that is, how the upper teeth bite over the lower teeth. Otherwise, if you put the brackets in the wrong position, when she goes to bite, she will fracture them off. Okay, open. So what you will see is as I put the bracket on, I'm going to have her bite. So that tells me that the bracket is not being bitten on by the top teeth. Again, in review, the top brackets go somewhat towards the rear of the tooth, and the brackets on the bottom go somewhat towards the front of the tooth. Viewers should be aware of the fact that I consider myself to be part of a healthcare team. It's not just me doing this. Both Erica and Ray have been given medical clearance to go ahead with this liquid diet. I will wire them and take care of their teeth and gums and their jaw joints and make sure that no harm comes to them. Because if I see that that's happening, well, I'll just stop them from proceeding with their jaw wiring. It's up to them to lose the weight. They know that they have to be on a low-calorie diet. I have suggested to Erica that she could live just fine on 1,100 calories, and Ray could do it on just 1,300 calories. Indeed, for every pound of excess weight you have an extra 3,000 calories. Now, when you have a normal meal might be 1,000 to 1,500 calories. So for Erica, who is 170, and she wants to go down to 130, so she's 40 pounds overweight. She's storing 80 extra meals on her body. So the object of jaw wiring, if it hasn't occurred to everybody, is to prevent you from eating solid foods, because that's where those extra calories come in. So let's give you the apartness to which your jaws are going to be apart. Are these straws bothering you? No, you sure? Okay, very good. Wiring through. You pass through one, you pass the wire right through two, feeding it through all the way. Now you have a good length, okay? If you have a wire with a ragged edge, it won't help you. So get to a nice smooth piece again. So the dance continues. 1, 2, 3, and then we're going to come around and through 6. Now take the other one. Come through 4. Exactly like you saw on the little demo, huh? Okay, we are through. Then make the piggy tail, grab it with your nails and hold it tight so that you can make the pigtail a little bit tighter. Once you do that, then you can have to hold it out here and go 3, 4, 5, but never so tight that you might cause the bracket to become detached. Take the wire, cut the piggy tail off, so this little piece has to be turned in so it doesn't bother you. You're doing beautifully. Again, I'm going to repeat the dance. Gently feed the wire from the top Don't let the wires twist around. 1, 2, 3, and then finally top wire. 1, 4, 5. Join them together like we did on the other side. Cut the little wire, and then you're going to tuck it in. Okay. You can go say hello to Ray. Ray, come on in.
It's done.
While I was doing the really painful part, I was in there paying for it.
That's the hard part.
Congratulations. This is a chart of reminders. These are the most important things you really have to know about. You know that the first week of what you're doing is really hard. You're really changing your ways. It's like withdrawing from some sweet pleasure that you need every single day, right? The protocol that you have to follow is 5 weeks being wired and then 5 days without wires to allow your joint to function at maximum capacity, both forward and back and right and left and open and closed. Nutritious liquid diets, AnnCollins.com, or choose a local dietitian to assist you. Ann Collins put me on the map because she has now given me the credit that I am the person who invented orthodontic jaw wiring. This next one is fairly important. Alcohol and approaching illnesses may lead to vomiting. Wire prevents full release of the vomitus, which if breathed back into your airway can lead to serious consequences. Just as though you were in a restaurant, you ate a piece of food, and it gets in your airway. That's serious consequences if it gets down your air pipe, okay? Okay. Notwithstanding the fact that 50,000 people a year have their jaws tightly wired together, there are no reports of any patient's demise. Please, if you're feeling nauseous or anything that indicates that you're going to be sick, take the stuff off immediately. Then when you feel better, you can put it back on. There are 5 instruments to remove the wires.
That's the tool that got me here.
That's the tool that got you here. Exactly. And of course, Ray, you're a cabinet maker, so you've seen this instrument. You know well that it is. These are emergency removal, you know, and rip, right? And don't worry, all visits to me from now until the end there are no further costs.
Now mine will automatically unclamp when I take the wire out.
You cut those pieces out it comes, and you're open. And then you're open and free. Get on the scale. Counting calories is very, very important. You should know. The reason that it's terrific to count calories is in the future, you should know what you're putting in your mouth. When you go to the store and buy an item, look to see when you pick up that candy bar, that Snickers bar, that it's got 425 calories in it. For that little moment of sweet pleasure, you're going to pay for 425 calories on your body. So count calories. The reason you're counting calories is not just for the purpose of jaw wiring and weight losing now, but for the rest of your lives. I have no doubt that there will never cease to be members of the dental and medical community who look upon OJW with a jaundiced eye. Nevertheless, I say, offer the service. Choose your patients carefully. Do the OJW methodically and be responsive to your patient's needs. It's my fondest hope that OJW patients will reach the goals they set for themselves when they completed the informed consent. If they do, they can expect to lose 1.5 to 2 pounds each week, and perhaps even more if they exercise. Providers, you have to tell them to keep in mind that above all, their goal is to modify their eating behavior forever.
I'm a fan of Dr. Ted. I'm a fan of Dr. Ted. He's the man, Dr. Ted. Nobody does it better.
I guess. Doesn't feel that. I'm getting kind of used to it.
If this works out, we're going to come up with a low-cost alternative that involves duct tape and handcuffs.
Yeah, I know.
So.
His name is Dr. Ted, and I know that he's the one to fix your smile right. You'll be happy when you're done.